There are only about 3 weeks left until kids head back to school. So we're talking to an expert, giving you the ABCs of sleep, huh? Adjusting your back to school sleep schedule. We're joined by Dr. Alice Hoagland, director of the Insomnia Clinic at Rochester Regional Health. Welcome back with us.
Thank you.
Good to have you here.
Good time of year to be here.
Yeah, I know you said last year we were here, we had food.
Last year the food trucks were here. I was all excited. It was exactly the same thing.
Deja vu. Right. But you were saying during the break, now is the time. We want to start that routine.
Yes.
It's time to start doing it now.
Absolutely. Primarily, you need to start doing it for your sort of preteens and teenagers because all teenagers have something that we call a delayed sleeping phase. They become night owls. So most parents know that over the summer their kids are up till 1, 2 o'clock in the morning. And, you know, school, you got to get them up at 6 o'clock in the morning. So it's time to start working to move them back, advance their sleeping so that they get to sleep a little earlier and wake up earlier.
What's a good bedtime?
Well, you know, interestingly, oftentimes parents will mistakenly think that what they want to do is to get their kids, to put the kids to bed earlier. In fact, kids are not sleepy at, say, 10 o'clock at night because they've been staying up so late. So what we advise is that you actually start to wake them up earlier. So if your kids have been, hypothetically, waking up every morning at 10 o'clock for 3 or 4 days, you got to get them up at 9 o'clock. And then for 3 or 4 days, you get them up at 8 o'clock. They will naturally start to go to sleep earlier at night. The other thing that's real important to do during this period of time, work hard to not let them nap in the afternoon, because napping then allows them to stay up later at night. So you want to get them to not nap and start progressively waking them up a little bit earlier in the morning.
I like that. So just to kind of summarize what you're saying is it's not so much the routine of, okay, everybody go to bed at 8 o'clock now. I know you've been going to bed at 1 a.m. Let's go to bed at 8 now. It's the wake-up routine which is going to impact that.
It is the wake-up time. You've got this little gland in your brain that regulates your whole body on a 24-hour basis, and that gland gets set by when you wake up in the morning, not by when you go to bed.
I like that. What happens, and let's talk about why sleep is so crucial for adolescents and young children. What happens if, say a parent didn't start to rein that in? What would happen going back to school and, you know, they're not getting the proper amount of sleep?
Yeah, kids who are chronically sleep deprived have a variety of negative side effects that go on with that. Interestingly, for young kids, one of the negative effects is that they look like they have attention deficit disorder. They lose focus. They sort of bounce off the walls all over the place. And so sometimes parents are not aware that it's the lack of sleep or even disrupted sleep that causes them to have that sort of lack of focus. That same thing happens to adolescents. We also know that teenagers who don't get enough sleep start to develop some underlying mood issues, sometimes a little low-grade depression or anxiety. Some of that is because these kids can't see themselves functioning at a level that they want to. They're just logy. It's the same thing that happens with adults, but with kids who are in school, it's really more critical.
And it's harder for them to kind of channel that or manage that.
Oh, exactly.
What else? I know we got 30 seconds, but I know you said wake them up, start to wake them up an hour earlier, you know, every few days. What else can we do to get kids to go to bed earlier?
Well, again, it's that wake time, but getting kids to go to bed earlier is a routine that they need to start planning. So I would engage with especially your teenager, way ahead of time to say, you know and I know that we're going to have to start getting you up earlier. What sorts of things can we do to help you get to bed a little bit earlier? One of them, by the way, is to not let them eat so late at night, which is a habit that a lot of teenagers get into.
So past 8 o'clock, no more food?
No more food after 8. You're right.
All right. Kind of like, you know, don't feed my 3-year-old after 8. Turn into gremlins. No, kidding.
Exactly.
Can people go somewhere to find more information on sleep habits?
Yes, they can. They can actually go on to Rochester Regional Health, the Sleep Disorder Center. We have a little website there, and there's all sorts of tips. The other thing is that you can just go onto Google and Google things called sleep hygiene.
Sounds good. Dr. Hoagland, thank you so much for being here, and best of luck to the parents getting those kids back on a routine. I'm right there with you. We're all in this together, right?